Good morning, everyone. So this is a little bit different presentation topic for this session, but I'm here to present on our collaborative work as a collaboration from the University at Buffalo, Albany Medical Center, and Rensselaer Polytechnic. Oh, sorry, and we had nothing to disclose. So 2 years ago, we presented some work where we had looked at the FLS suturing task and how experts and novices compared in their performance on the intracorporeal knot tying task, and looked at the activation across their brain to see what parts of the brain are active when you're doing these motor skills tasks. And our goal behind this work and the continuing work is then to say, can we develop objective metrics that can let us know that someone has reached a point of expertise for these skills beyond just looking at performance time. And so when we looked at the FLS suturing, we did see that there were differences in the prefrontal cortex and in the motor areas. And that prefrontal cortex is used for executive function, motor planning, and strategic planning. So the experts typically have lower activation in those areas when they're doing a majority of tasks. And so we wanted to see, do the brain activation patterns correlate now as we are doing robot-assisted surgery, or suturing in particular, and do the patterns, how do they differ for laparoscopic suturing versus robot-assisted suturing? And the reason, we hypothesize that they might be different is just the nature of the physical component to the task. So a little bit less of a motor skill piece when manipulating the robot controls compared to the laparoscopic tools. And so this study involved 16 participants. We had 9 novices and 7 experts between the University of Buffalo and Albany Medical Center. And we used the FRS dome and performed a running suturing task along, as you can see there. They performed each 3 repetitions of the running suturing with a rest period in between. And the way that we captured the brain activation in these studies is looking at functional near-infrared spectroscopy. So we look at the oxygenation of the brain regions so that we can localize that activation across those regions. And we had a montage that covered the prefrontal and motor areas, or sensory motor areas. And so what we saw, is shown here. These are the regions of the brain, and what we see in red is more activation, or areas where there's more oxygen consumption, and then the bluer areas are less activation. And so when we look at the novices on the left side, they had higher activation significantly for the prefrontal cortex, right, that front portion of the brain, and then the superior temporal gyrus, so over in the top right. In those areas, as I mentioned, for the prefrontal cortex, looking at motor planning and executive function. And then for the temporal gyrus, looking at dorsal and ventral visual streams, so integrating that visual information that they are receiving. There was a contrast between the experts and novices in the sensory motor adaptation areas. So this result was consistent actually to what we had seen for laparoscopic suturing skills, as well as for the pattern cutting skill and peg transfer skills. So when we've looked at, increasing levels of complexity, we've still seen similar patterns between those who are experts and those who are novices. And that's actually promising that there's similar relationships or patterns, and that we can use this information to identify, what does it mean to have expertise, and what does experience change in terms of how the brain is making those connections and activating during the tasks. Right, so seeing consistent areas will help us in developing evaluation metrics. So that's what we are working towards, and also training programs to support getting to that expert level for that activation. And we're also in the next steps looking at how do we tie this over to cognitive tasks. So if I take away the motor skill component of the task and have you talk through or think through the actual performance of a surgical procedure, are you still lighting up similar regions of your brain during those tasks? So thank you. I acknowledge this was funded through the Department of Defense and the U.S. Army.